Hello and welcome to this session. My name is Telios Kataragakis and I am Associate Professor at the Nursing Department of the National and Kapodistrian University of Athens, Greece. The following presentation will focus on the impact of cancer healthcare professionals, especially nurses, on health literacy. In the treatment and care of cancer, health literacy has become more widely acknowledged as a significant and perhaps successful strategy to enhance results and lessen health inequalities among various patient groups. Healthcare professionals in cancer care are linked in various ways to health literacy, either as individual professionals or as members of an organization. To reduce health literacy challenges in care settings and facilities, it is crucial to use plain language during orientation, to develop orientation booklets and participate in the development of science in the healthcare setting. Cancer nurses need specific skills to play a critical role in reducing health literacy, particularly by assessing health literacy of patients with cancer, their caregivers, and their families. Essential skills include using open-ended questions, understanding cultural sensitivity, considering differences between gender and age groups, improving communication skills and plain language training, moreover fostering mutual learning, establishing therapeutic relationships, promoting collaborative goal setting, encouraging behavior change in cancer patients, and strengthening the roles of advocates, counselors, and guides. Key nursing strategies for effective communication and meeting patients' health literacy needs include conducting appropriate multidimensional assessments of patients' health literacy skills and considering factors such as age, educational level, minority status, and life experiences. Recognizing that all patients and families may have limited health literacy, ensuring patients' understanding, developing individualized communication plans, supporting patients in problem solving, exploring patients' emotional reactions to information are fundamental strategies. Moreover, involving family members and other members of the healthcare team and using teach-back methods for verbal and written information are also promoting both communication and meeting patients' needs. Identification of cancer patients with low health literacy is of paramount importance. Specific behaviors of patients with cancer associated with low health literacy are avoidance of asking questions, displaying signs of nervousness, confusion and frustration, completing forms incompletely or incorrectly, and offering various excuses when asked to read printed materials. Communication skills are essential for improving health literacy. The most important of them is using plain language communication strategies, such as clear and simply written and spoken language, speaking slowly without haste, starting with the main objectives and repeating important points. Additionally, define and explain terms using concrete examples, illustrations, narratives, and reminder cues. Addressing cultural communication, including language barriers. Encouraging patients to ask questions. Asking what questions they may have after a physician visit. Actively listening to patients' queries, and of course providing scripts for frequently asked questions are also included in effective communication strategies. The teach-back method, as mentioned before, is an important strategy to improve health literacy. This method ensures that information has been transferred to the patient, by the healthcare professional. Based on this method, the patient explains or demonstrates back to the healthcare professional what has been taught. Depending on the results, the healthcare professional makes the necessary clarifications until the patient achieves the desired educational or training outcome. It is extremely important to clarify that any miscomprehension by the patient is due to the miscommunication with the healthcare professional and not due to the patient's inability to learn. Providing printed or electronic written material is a useful strategy for managing health literacy. Unfortunately, health material often do not meet the literacy skills of the average adult with a secondary school education. This can be addressed by developing and implementing regulations for the design, piloting, and production of critical health-related written materials. In addition, the application of teach-back methods and the provision of materials that always accompany verbal communication can enhance the effectiveness of materials in terms of health literacy. The first step in preparing appropriate health materials is to involve health care professionals in the development of these materials. Fundamental instructions for the preparation of these materials include designed and written for ease of reading, written in plain language, easy to understand and comprehend, accompanied by images relevant to the text, featuring able white space to avoid crowding the page, checked and pilot tested for clarity, and moreover aimed at a wide audience and organized by reader preference and priority. To summarize this presentation, it is of paramount importance to recognize the challenge of health literacy in cancer care and to identify patients with cancer, their caregivers and their families with low health literacy. Education and training of healthcare professionals in health literacy, improving oral and written communication, and implementing an individualized communication plan are key points. In addition, establishing appropriate behaviors and strategies is an important intervention for improving health literacy in cancer care. I hope that this presentation has helped to clarify the role of cancer health care professionals and especially nurses in health literacy, and I would like to thank you for watching.